not that tall. I need to stand on my toes. Ready? Well, good morning, everyone. Thank you for coming. If you don't know me, or if you forgot me, my name is Nicole Vega. I am the Director of Clinical Services here at John Knox. I just recently celebrated my 10-year anniversary here, so I've been with some of you for a while. I have a master's degree in nursing. I am a registered nurse, and I recently got my nursing home administrator's license. So we are going to go through kind of all of the health services that we have on campus that kind of fall under my purview. My job is to oversee all of the clinical products that we have on campus. So I serve in kind of a consultant capacity for Majestic Oaks and Oakview Suites. I have a direct oversight for home health, both our skilled and our private side. I oversee outpatient therapy. I oversee the nurse practitioner clinic with Martha and our medical response teams with our nurses and our EMTs and paramedics. So we're going to go through all of this. So what we know is that health is on a continuum, right? We have periods of wellness and we have periods of illness. And our goal is that during those times of health and wellness, we focus our efforts on planning, on making our advanced directives, on researching insurance and supplemental policies. You may want to tour Majestic Oaks or Oakview Suites at that time, maybe look into home health before you need the services, right? Because if something happens, you're walking your dog and your dog sees a squirrel and out in front of you they go, and you go down and end up at the hospital with a hip fracture, that's a bad time to start planning. That's a stressful situation for you. Maybe you're a caregiver for a spouse, and now you're worried who's going to take care of that person. Maybe you're like me, and as a pet owner, you're more concerned about your dogs and your cats than your pets, or than your husband. I spent 2 days out of town last week, and my husband's very upset because I was more concerned about my dogs. But when we're in those periods of illness, we have anxiety and stress and fear, and that's a bad time to try to plan and make decisions, right? So when we talk a little bit about the aging process, the relationship between aging well and mobility are very clear in the literature. Remaining mobile holds a tremendous amount of benefits for you, helping preserve your independence. This helps you with your ability to do daily tasks, being able to do your laundry, make your bed, load or unload your dishwasher, make yourself something to eat. It helps for the prevention of falls. Reduced mobility increases your risk of falling. There are a lot of studies that talk specifically about lack of mobility and the significant increase for the risk of falls. Improved recovery time. If you are more mobile and you have an illness or injury and you need to recover from that, you tend to recover better the more mobile you are. Joint and bone health. Anybody suffer from arthritis in the crowd? I have my knee replacement surgery scheduled for less than 30 days from now, so I understand that pain. The more you move those joints and those muscles, the less those ailments affect you, and the easier you are to recover from them when you do. I was talking with one of the therapists, and the fact that I still have full range of motion in my knee will help me recover. Won't necessarily make recovery less painful, and I'm not looking forward to my time with therapy, but I will be there, probably right alongside some of you. And then cardiovascular health, right? Movement and mobility are crucial for heart health. And so a lot of what I'm going to talk about is going to kind of tie in. The more that you take part in some of the things that we offer on campus, the more likely you are to remain independent as long as you want to be independent, right? Everybody's heard the saying that an ounce of prevention is worth a pound of cure. The benefits of physical activity include increased energy levels, reduced risk of chronic diseases, improved sleep, reduced pain, joint, and stiffness. improved bone and muscle strength like we talked about, boosted brain health, and improved cognitive function, improved mental health. There are studies that show that the more you're active, the less you experience symptoms of depression. And then overall improvement in quality of life. For both Talina or anyone in the outpatient therapy, those are great resources for you to help get you up and moving. In the back of the room, I have 2 therapists here today, and they're going to be here for the duration of the chat and a few minutes after to answer any questions that you might have. So, Kaylin, Chrysler, waving at you. So let's talk about what John Knox has to offer to help you along your way, right? We offer a comprehensive health services plan. We want to ensure that anything that you need from a health perspective, we have available to you. It's designed to promote aging in place. I know that there is that rumor out there that you shouldn't call the resident nurse or the medical response because we're going to send you to Majestic Oaks. Has Stephanie visited anybody in the room? Did you end up at Majestic Oaks immediately? No, you did not. Okay, so that's not our goal. We want to promote independence for as long as possible, but independence doesn't always mean without services, right? There may be some things that you could use a little help with in order to stay independent. And when we talk about the services, you're at the center of everything that we offer. If there's something you need to reach out to me so that I can make sure that you get it. So this is kind of a snapshot of all of the different things we have. And if you could just picture you standing in the middle of that circle, right? We have the nurse practitioner clinic, our wellness liaison, the resident nurse and medical response teams, our home health teams, outpatient therapy, assisted living and Majestic Oaks are certainly there if you need it. And then we have Talina in fitness. And all of these are represented in your life care committee. So when we talk about independence, I want to explain what we define independence as, right? That you're alert and oriented to person, place, time, and situation. That you have appropriate responses to situations as they occur. You have the ability to recognize emergencies such as a fire alarm. If there was a fire somewhere near you, could you safely exit your unit? And the ability to use your strobe lights in the event of an emergency. So I want to take a brief moment to talk about apartment residents specifically and that ability to recognize and respond appropriately to situations like fire. If you are living independently in the apartments, we would need you to be able to exit your unit at the appropriate time and get into the stairwell without your assistive device. Because if you think about it, when the hallways might be filling with smoke and your other apartment friends are trying to exit, I don't need a bunch of walkers and wheelchairs in the hallway. That presents a danger to other residents. So I need you at least to be able to get from your unit into the stairwell without an assisted device. And then we can take care of you from there, okay? Because the stairwell is where we would get you to first. Does that make sense to everyone? Independence also refers to your activities of daily living. These are things like bathing and eating. Can you get to and from the dining room? Can you get dressed without assistance? Can you take a shower without assistance? How are you at transferring out of your bed to the chair and toileting and incontinence? We have a life care committee, and sometimes people ask me a lot of questions about the life care committee. So it consists of an interdisciplinary team of staff from across the campus representing the most comprehensive health services that we have. So you can see kind of a list of everybody that's there. I'm certainly in that meeting. Mike Buxton, the Director of Operations, Stan, our Director of Campus Services, the Administrator and Director of Nursing for Majestic Oaks, the Director of Nursing for Home Health, the Resident Nurse, the Chaplain, Martha, our Nurse Practitioner, and the Wellness Liaison are all there. And the goal of the committee is, again, to keep you as independent as possible for as long as possible. We want to promote independence with appropriate services. We meet every weekly on Wednesdays, so that's my next meeting after this. So let me pose a question to the audience. If our goal is to keep you as independent for as long as possible, how do you think we best accomplish that? With your help. Right? If I make a recommendation from the life care committee that you should go see therapy, and you tell me no, that's not very helpful. If I recommend you go to your doctor as a follow-up, we think some of your medications might need tweaking, and you say, oh, she doesn't know what she's talking about. That doesn't help us in that goal. So I would encourage you that when Stephanie comes out, or when a member of the medical staff comes out, or when therapy reaches out to you to say, hey, we'd like to see you for an eval, we'd like you to take us up on that option. In the Life Care Committee, we do review all of the incidents and accidents and make recommendations for prevention and safety. So certainly if you've had a fall in the last week, you might come up. If you have been ill or hospitalized, you might come up in that committee. We look at residents who are hospitalized, and we track residents across the continuum. So if someone is not in their normal home, then we look at them. So if somebody was in independent living, they've been hospitalized, and currently they're at Majestic Oaks, we kind of follow that because we want to talk about barriers to getting you back home. And we want to put in place interventions to get you home as quickly as possible. We review residents receiving home health services. I want to know if you're successful with the amount of services we have in place. If we're doing a weekly pill planner for you, and we deliver it on Monday, and we come back next Monday, and all those pills are still in that planner, that's probably not been a very successful endeavor for us. So we're going to have to try some other interventions. Again, that pill planner is full of cat treats. I have concerns. So we might send the nurse out to increase the frequency of services to help you maintain. If you're not taking the medications that your physician has prescribed to you, the chances are high that you may have a swing on that pendulum and end up back in one of our healthcare facilities. And then we make committee decisions to support or decline permanent placement. So when the decision has been made that we think that you are no longer safe to live independently, and we are making recommendations for a permanent placement either at Oakview Suites or at Majestic Oaks, that is a committee decision that is then eventually approved only by Mr. Trainer. Okay? The reason the Life Care Committee is made up the way it is these are experts on our campus in health and safety and wellness. And our recommendations should not be brushed off or taken lightly. We know what it takes to help you stay independent. If you think about it, when you see your doctor and he recommends a new medication, in today's world with all of the readily accessible information on the internet and misinformation so readily available, about 40% of the patients will not take the medication prescribed or as prescribed from their doctor. Sometimes what you do is adjust your dose. I don't need the whole pill. I'll just take half. I don't need to take it every day. I feel fine today. But it really depends on how that medication works, what's the half-life, how long it stays in your system, how proficient your kidneys or liver are functioning to determine what that right dosage is for you. So again, when followed, these recommendations can help extend your independence. And that's really what we're all here for. So our resident nurse in medical response, we have Stephanie. Most everybody has met Stephanie when you've moved in. She's my registered nurse. And then in the evenings and on weekends, I have paramedics and EMTs. Some of you have met Sam or Tim. Yeah. They provide dedicated medical response for approximately 16 hours a day. When they are not here, the response automatically drops to Oakview Suites or Majestic Oaks, depending on where the nurses are staffed. They conduct wellness visits. They are typically your first experience at John Knox with any member of the medical staff here. They do an initial assessment for all residents. So when Stephanie comes out, we're kind of evaluating to see if we think you need services quickly, or if we see you struggling when you move in with mobility. We might recommend that you go speak with one of the therapists. And we respond to about 80 calls per month. Then we have Martha. Martha is our nurse practitioner. She has been at John Knox a little bit longer than I have. She does specialize in geriatric medicine. She is here for primary care services. In Florida, nurse practitioners are allowed to do something called autonomous practice, where they do not have to be supervised directly by a physician. And so she is licensed for autonomous practice. She can do preventative care and physical exams, chronic disease management, and she will make referrals to specialists as she feels appropriate. When she makes those referrals to specialists, the good thing about her office is they will follow up. They will get notes from the specialist because then she wants to adjust what she's doing for you to what that specialist has prescribed. Her office is open Monday through Friday. They are now located in the old administration offices in the center. All of the phone numbers that existed for Martha before are exactly the same. We do have laboratory services available early mornings on Mondays and Fridays. She is also available for second opinions, and she does follow residents through the continuum. So if she is your primary care and you end up at Majestic Oaks does require that there is a physician overseeing care, so you would probably go under Dr. Kershid, who's our medical director, and then Martha would still follow you throughout the continuum. We have Amanda Logan as our wellness services liaison. Everybody loves Amanda. Amanda's role on campus is to address psychosocial aspects of life changes and to promote psychological wellness, right? Linking you with JKV services. She is well versed in all of the various clinical components that we have on campus so that when you are in, again, that pendulum of health and wellness and you have questions, she can start guiding you for what we think is most appropriate. Back before we had Amanda, I would send Stephanie out to do some of those things. But some people suffer from white coat syndrome. And when I send Stephanie, sometimes you don't open the door. So Amanda presents from a non-clinical presentation, and so we appreciate the support that she gives to all of the clinical staff here. She is going to help coordinate those JKV services. If you are transitioning, for example, into Oakview Suites, she will help you with that coordination. She will help set up your tour with the administrator. She will follow up with you and make sure that you've received everything that you need. She's also here to help with end-of-life challenges. And then, of course, she organizes many of the support groups that we have on campus. And so some of those support groups are our Parkinson's support group, our grief support and caregiver support, visual impairment, memory impairment, and our diabetic support groups. So home health services. We're going to get a little bit into the weeds here. So we have two different types of home health services. We have skilled home health services, which are generally covered under your Medicare benefit, right? So you've had a qualifying hospital stay, or you've been to your physician and they are recommending home health services. Those can typically be activated under that benefit. Then we also have private duty services, which are not covered under the Medicare benefit, and as appropriately titled, they are paid for privately by you. So skilled home health services, again, are typically covered by your insurance, and they are ordered through your physician. They may include a nurse, physical therapy, occupational therapy, or the speech therapist. The clinicians will set goals for your care and assist you in meeting those goals. And then as those goals are met, the services will cease and they will no longer be covered by your insurance. Medicare is very specific in how it defines who can receive home health services. And so they do say that you must be confined to your home, that you must need those skilled services, that you have to be under the care of a physician. So when we say, hey, you haven't been to your primary in 3 years, we probably need you to go see them if we're going to be able to continue home health services. You have to receive services under a very specific plan of care established by the clinicians and reviewed and approved by the physician. And you have to have had a face-to-face encounter with your physician before we can officially start services. You have 30 days, really. So again, we may need to send you to your primary care early in your home health services to make sure that we can continue to provide that. This typically follows an inpatient hospital stay or a stay at Majestic Oaks, and now you're discharging back home. And so we are going to continue what Majestic Oaks was working on, but be able to do it in your home environment and help transition you home. So this is the criteria. In the first column, one of those must be met. So because of illness or injury, you need the aid of a supportive device such as a crutch, cane, wheelchair, or walker, the use of special transportation, or the assistance of another person to leave your home. Or you you have a condition such that leaving your home is medically contraindicated. Easy example of that was COVID, right? It was a bad idea for you to be out spreading the wealth if you had COVID, so you were confined to your home, and so that would have met that home health criteria. If you don't meet one of those two, you have to meet both in the second column. There must exist a normal inability to leave your home, and leaving your home requires a considerable and taxing effort. So if you're homebound and on home health services, can you go to every JKV event and every dining venue? Cannot. Because that would tell Medicare that you don't need homebound services and you could receive services on an outpatient basis. Okay, under the Medicare skilled, again, you're considered homebound if your absences from home are infrequent for short durations of time, the need to receive healthcare services, so if you need to go to your doctor's appointments, that's certainly allowed under the Medicare skill and the homebound criteria. For religious services, so you can still go to church on Sunday. If you attend adult daycare or for other unique events such as funeral, graduations, weddings, things like that. You can go to the hairdresser or to the barber. But again, these things should be infrequent. So could you go to Cranes occasionally? Sure. Could you go every night? No. All right, so that is skilled services covered by your insurance, right? Then we have private duty services, and those are divided by who is providing the service. So if it is a licensed staff member providing a service, a nurse, a therapist, then those are considered private skilled services, not to confuse you. If they're covered by someone who doesn't have to have a license, a home health aide, a CNA, then those are considered just private duty services. So skilled nursing requires the services of a licensed nurse. We may do medication management, and under medication management, there are two different options. We can either come out and do daily administration. So those are those cases where I came out, I did the pill planner and I came out and you hadn't taken a day's worth of pills out of the 7 days. We might try it for one more week with some encouragement, but if that doesn't work, then we're gonna recommend daily administration where the nurse actually comes out and administers daily to you. We also do those weekly pill planners. Under skilled private services, we can do wound care, catheter care, and disease or medication education and management. If you're on skilled private duty services, it still requires a physician to sign off periodically. So the weekly pill planner, if you were to sign up for a weekly pill planner, it's not just the planner that we do. We will come out once a week when we drop off the planner. We will do a vital sign monitoring check. So we'll check your blood pressure, your pulse, your temp. We are going to monitor your weight weekly. We will take over managing all of your prescriptions at that point. So we will handle new prescriptions, refills, prior authorizations if you have a high-cost medication. We will communicate to the physicians to ensure that those medications are taken care of. We will also help you with destructions of medication that are no longer used or expired. We will also help you manage all of your physician appointments, including scheduling transportation, arranging transportation, and completing any necessary physician paperwork. So if you have a new referral to a cardiologist and they give you 15 pages to fill out, we will help you with that. We manage laboratory services. So if you're on medications that require laboratory monitoring, we will schedule that for you and help you get to that lab service. And we will review those labs and communicate that to whichever prescriber has ordered those. We will communicate with your medical power of attorney as needed. And we also help in the assistance of filing any long-term insurance claims that you might have. For non-skilled private duty services, we offer bathing and dressing and grooming, incontinence care, meal assistance. So sometimes while you are homebound, maybe you're receiving skilled services and you need help getting meals, we will arrange that and help get you that. We can do safety and fall prevention. We also have companions that are just there sometimes when you need somebody to chat with or somebody to do light housekeeping or assistance with transportation or shopping or pet care. We do a lot of dog walking and a couple cat boxes and some birds here and there. I think somebody still has a turtle on campus too. We now have home health extended care. This is an option for 24-hour care. Now you can take those in increments of 4, 8, 12 hours of care, but 24-hour care when you need it. This is performed by our own home health aides and companions because we know that sometimes care doesn't keep normal office hours, right? We know that sometimes you're sick at 3 o'clock in the morning. We know that if you have had some kind of setbacks in your health and you need help overnight, but you do better during the day, we can put those services in at those times. So we want you to know that that's an option. We have seen a huge increase in the home health extended care since we launched it about 60 days ago now. We went from about 5 visits to about 76 visits with residents on campus. So we have seen a big jump, and we appreciate that, and we're glad to be able to offer that service now. Our goal is, again, to be able to provide on-demand health services when the urgent need arises. Maybe you're a caregiver for a spouse again, and you end up hospitalized, and you're worried what's going to happen to your loved one. We can put in the home health extended care and stay with your spouse while you've got something else going on at the hospital. We also provide support for safe discharges from those higher levels of care. So maybe the standard skilled home health services is not enough. Maybe a nurse only visiting once or twice a week is not enough for what you need. So we may be able to put in some private duty extended care to help support that. Outpatient rehab. So rehabilitation is defined as a set of interventions to optimize your functioning, to reduce disability in individuals with health conditions and how you interact with your environment. So we want to address underlying health conditions and those symptoms. We want to modify your environment to better suit your needs. Maybe just putting in a shower rail would help you. I know when we did the therapy chat a while back, we talked about that towel bar that sometimes you use to get out of the shower with. Those aren't very sturdy. But we could replace the shower bar with a bed rail of some sort or a sidebar. And that is a better support system for you. Helping you use assistive devices or products. If you got your walker from your neighbor, it might not be the right height for you. It might be an inappropriate device for you. And there are some studies that show that using an inappropriate device is worse than not using a device at all. So if you do get assigned a walker or a cane from your physician, please come see therapy so that we can help you adjust that. The height and things matter on those. So we also provide education and task adaptation. So task adaptation would be if, let's say you experience conditions of COPD where you become very short of breath. And so when you get up in the morning and you know you have to go to a doctor's appointment at 9 a.m., if you're getting up at 5 a.m. in order to be able to get dressed and ready to go and catch your breath, we can help with that. We can teach ways to task segment items for you to make that a little bit easier. So physical exercise and training to improve muscle strength, voluntary movements and balance for persons with stroke or Parkinson's. We might modify your home environment, again, swapping out that towel bar for something different. Maybe offering you a grab bar on the side of your bed. Maybe you have a bunch of rugs around your home. We don't like rugs around your home. I know you think they're pretty, but they're a horrible trip hazard. Maybe you keep all of your plates on the third shelf of your kitchen cabinets, and stretching and reaching for those plates and trying to pull something heavy down is a bad idea. So we want to look at those things and offer modifications for you. We want to educate someone with heart disease on how to exercise safely. Positioning and splinting devices to help with pain and swelling and to regain movement. And then we have speech-language pathology to improve a person's communication after some type of brain injury or ailment. So kind of specifically, occupational therapy, not everybody knows what occupational therapy does. So physical therapy is pretty easy, right? Big muscle movements, lots of exercise, but sometimes people don't know what occupational therapy does. So occupational therapy is designed to help you with those activities of daily living. Bathing, dressing, grooming, showering. They help you if you have a change in function that could be related to an injury or maybe just poor range of motion or that immobility. Those home safety assessments. Crystal loves to come out and look at your home and find ways that she can help you modify your home environment, again, with the whole goal in mind to keep you as independent as possible for as long as possible. Pain management for anything upper body, right? Neck, shoulders, elbows, wrists, anything arthritic or musculature that can help with. If you have daily pain, like shoulders and above, your neck hurts when you're watching TV, your shoulders hurt, you're always having to readjust and things crick and crack when you do that, you need to go see Crystal. She can help you with those things. Activities of daily living, again, getting dressed and tools and techniques to make it easier. Maybe you need a sock aid or a reacher of some sort. Toileting hygiene. And then again, instrumental activities of daily living, which are kind of higher level function activities, right? Driving and safety awareness, reaction time, meal preparation, laundry, medication management. If you are having so much arthritis in your hands that you can't open your pill bottles, that could be a problem. So when we come over and we see that all your pills are just open on the counter, that's usually a clue for us. Speech therapy. We want you to know what speech therapy has to offer too. So speech therapy is very important for seniors because it helps them maintain and improve communication skills. As we age, our bodies change. It does affect speech and language production. For example, vocal cords weaken. They make your voice sound hoarse, maybe breathy. You may have difficulty with articulation, making certain sounds or words difficult. Speech therapy can improve communication, increase independence, and reduce the risk of isolation, improving cognitive function, reducing the risk of dementia, and improve safety. So please see Mandy. So we can do outpatient speech therapy as well. Sneak peek, we are about to launch aquatherapy. So we are going to launch aquatic therapy through outpatient therapy. It's going to take place in a warm, supportive pool environment that helps you move more easily and comfortably, probably better than you can move on land. It helps you because water therapy is more gentle on your joints. The water's buoyancy helps reduce some of the impact of gravity, making those movements easier for your body. It helps you stay upright and improve your stability. Helps with full body strength. Water provides resistance in every direction, helping you build muscle and strength. So maybe the idea of going and working out on the equipment just totally freaks you out. Come see us about aquatherapy. So Kayla's in the back. She's going to be our specialist in aquatherapy. So if you have questions about that, please see her. We are very excited to launch that, and more information about that will be coming out shortly. Let's talk a little bit about fall prevention. So has anybody read all the healthcare hints that have come out all year? Seen a theme? They're all kind of on fall prevention. So in the room we have lots of members of our healthcare committee. So if you're on the healthcare committee, can you raise your hand? Higher? So these people are responsible for some of those healthcare hints that have come out. And we focused on fall prevention because it's one of the biggest problems that affects our campus. And so we've put out tips on strengthening your core and participating in something like Tai Chi. We put out tips on home safety and a home safety checklist. Did anybody do the home safety checklist? I know it talked about those rugs you're not supposed to have. Medications that contribute to fall risk. We put out a high-risk list of medications. We talked about postural hypotension prevention. So if you are not very mobile and you get up and you're dizzy, it's because of your blood pressure, right? And so there are a lot of tips and tricks you can do. Even while you're sitting watching TV, if you're doing those little ankle pumps, that will help prevent something like that. So the Agency for Healthcare Research and Quality, the Centers for Disease Control and Prevention, and the World Guidelines for Fall Prevention and Management of Older Adults all concur that immobility and weakness are some of the largest contributory factors to fall risk. So, questions. Have you fallen in the past year? Do you feel unsteady while you walk? Do you worry about falling? If you answer yes to any of those, you're at risk. Could you rise from a chair, walk 10 feet, turn around, walk back and sit down in less than 15 seconds? If you can, good for you. If not, you're defined as a fall risk. How many times can you stand up from your chair without using the armrest at all? So if you were to sit in a chair similar to this and you were to cross your arms across your body, how many times can you come to a full standing position and sit back down in 30 seconds? I tried that last night. I will not tell you my score. For most of you, if it's less than 10 times, you are defined as a fall risk. So please, if you match any of those criteria, please call outpatient therapy. Let's remember that when we discussed earlier that an ounce of prevention is worth a pound of cure, you can control how well you age and how you recover from incidents simply by increasing your mobility and strength. So, all right, so when none of those work, and when we have tried therapy and we've tried different things, and we are now at a point that you need a different level of care, we have those available too. So Oakview Suites is our assisted living. Oakview Suites offers a standard license, which means that we are a residential facility that provides assistance or supervision with those activities of daily living. We provide assistance with medication administration. We provide assistance with transfers and transportation and meal service. But we also have extended congregate care licenses. So in order for you to need those expanded services, you must have a nurse available to provide services. You can provide greater assistance under an ECC license for ADLs. Maybe you require more vital sign monitoring than normal. Maybe you have a specialized diet or you're using enteral feeding, so like a tube feeding. Maybe you need supervision of cognitive impairments or some type of education to promote health and prevent illness. So we have this additional license in Oakview Suites so that, again, if we do have to change level of care, we don't want to have to do it again as things change for you. So we want you to be able to stay there as long as possible as well. Oakview Suites does require a physician assessment and orders. They're going to determine the appropriate level of care for you based on your need. We're going to create a service plan for you in assisted living that identifies what the staff will and will not be doing for you. That service plan is reviewed with you annually or as needed. We can also supplement any care that's received in assisted living with home health. So if someone is in assisted living and they're needing more services, or they've had a hospitalization, what have you, our therapists do go into assisted living all the time. And as you all know, assisted living is not part of your life care contract. And when you need more support, we have Majestic Oaks. So Majestic Oaks is our skilled nursing facility. We have 3 distinct units at Majestic Oaks. We have our rehab facility that has 30 beds. I should have taken that out. The remodel is completed on that part. Those are dedicated to short-term stays. So this is typically that after hospitalization and you're preparing to recover and go home. We have our memory care unit, that is a 45-bed unit. And then we have long-term care, which is all of our upstairs, which is 75 beds of residential long-term care. Now, I tell you where everything is and tell you what they are, but all of our beds are something called dually certified, which means regardless of your payer, so whether you're Medicare or Medicaid, you can go to any of those units. So if, for example, the rehab unit is full and you need placement after the hospital, we may have you upstairs. We didn't make a decision while you were at the hospital that we were converting you to long-term care. That's just where we need to put you for right now because I didn't have another bed available in the rehab unit. So don't think that just because you arrive and you're upstairs, we've made a decision for you. So Majestic Oaks has a variety of clinical capabilities. We have RNs and LPNs that are there 24/7. We do frequent vital sign monitoring. We might monitor input and output or specialty diets. We do have a registered dietitian on staff at Majestic Oaks. She's there 5 days a week. We do medication monitoring, blood glucose. We might monitor PTs and INRs, monitor therapeutic levels for different medications. We can do nebulizer or inhaled treatments. We can do any type of IV therapy, whether that's fluids or antibiotics. We can do enteral feeding. We can do that by a PEG tube, which is usually in your stomach, a J tube, which is in your jejunum, or TPN, which is feeding through a vein. And then oxygen therapy and monitoring. We can do isolation and infectious management. Maybe you have a surgical drain, so we might be managing that. Certainly any type of post-surgical care. Behavioral therapy and psychiatric services, so both psychiatry and psychology services are available. Wound care, we do have a wound care nurse and a wound care physician specialist that comes into the facility. And then we do laboratory and radiology services, most of which are available within 2 hours if we needed a stat service. We do have a full sweep of therapy at Majestic Oaks that is separate from home health and outpatient. Again, we have all 3 disciplines, physical, occupational, and speech therapy. We can do dialysis management. We have a team of social workers at Majestic Oaks for any social services needs or discharge planning. I mentioned we have the full-time dietitian, and then we have a full pharmacy service at Majestic Oaks. So obviously we are supported by our pharmacy, but we also have a machine at Majestic Oaks that carries 300 of the most common medications. So even when the pharmacy is not available or is closed, we have access to those medications if somebody is admitted late in the evening or something like that. We also have an emergency IV supply and can get additional support from we have a secondary pharmacy that can provide IV services as needed. And then we do have a consultant pharmacist that comes in. So when you go to Majestic Oaks and you're admitted, one of the first things that we do is send your med list off to a consultant pharmacist. And so they're going to look at your medication for duplication of therapy. They're going to look at medication that might contribute to falls. They might look at medications that have negative interactions. And so they're going to send us back a report, usually within 8 to 10 hours of you arriving, for us to make any adjustments or changes as necessary. I want to make a quick kind of comment about ambulance transfers. So we are seeing an increase in denials for your ambulance transports. So when something happens and we send you out through emergency services and the ambulance picks you up and takes you to the hospital, even if you're admitted, even if something significant has happened, we are seeing a lot of denials come back. And the ambulance service is saying that it is not covered under their requirements, and they are sending you a bill for anywhere between $700 and $815 for that trip. So according to the Centers for Medicare and Medicaid Services, I looked up their specific requirements. So it is that a condition that requires medical attention that can't be adequately addressed through other transportation. So you would require medical monitoring, medical procedures en route, you have the potential for deterioration, or you have a contagious disease requiring some type of isolation. The absence of that immediate medical attention could place you in serious jeopardy. Maybe you have an injury resulting from an accident or illness with acute symptoms like hemorrhage or shock, chest pain or respiratory distress. Those might qualify you for the emergency services. You can have non-emergent services covered under the Medicare guideline. It's a little bit more difficult because you almost have to meet that bed confined category where you have a non-ambulatory status, you're immobile, or you have no mobility of your lower extremities. Now I say that not because anybody's life is worth $750, right? If you need to go via emergency services, go by emergency services. Okay, we'll deal with the denial when it comes. But I do want you to be aware that we are seeing an increase in denials. And so if it is not an emergent situation or you have the ability to get yourself to the hospital, you might consider that. If you get a denial, please don't just pay that bill. Come see me. Okay, I will help you write the appeal. And I will do all the legwork for that. Now that doesn't mean that I will get it approved, but I've had a pretty good track record of getting approved and we can certainly try that. So you'll know it's denied because you'll get a bill in the mail for $715 or $815 for the transport, and then shortly after that you're going to receive a pink letter that comes from the Volusia County Ambulance Service. Okay, bring me anything you have from the hospital, from the transport, any bills that you receive, and I will help you with that appeal. So I kind of want to go back to that first section of the presentation where we talk again about these really comprehensive services that we have, right? We talked about the nurse practitioner clinic and our wellness liaison, our medical response teams, home health in great detail, outpatient therapy and the services that they can provide, and that if you're a fall risk, you're all going to go call them today and their phones are going to ring off the hook. Oakview Suites and Majestic Oaks and fitness. But again, that's not all we have to support you, right? We have a lot of ancillary services that really provide an addition to those medical services. I mentioned the registered dietitian at Majestic Oaks. She is available to consult with anybody that lives at John Knox. We have security here all the time that are responding to any pendant alarms or codes. We have housekeeping, laundry, and maintenance. So if you are having issues with ADL ability, we can add additional support services for you. We have our pharmacy that's available. We do have medical transportation to appointments. And then, of course, dining services to be available to provide meals and support for things that you might have going on. So who do you call? This is kind of a list of common extensions. Please know that with all of the office moves, and I have moved 4 times, all of our extensions are exactly the same. Okay, so if you had a phone number for us and one of us has moved, those have not changed. Please call the same numbers. If you have just general concerns about health or function, you can call Stephanie for medical response. Primary care needs, of course, Martha is available. Home health services, you can call Justine. Outpatient therapy, you can reach Casey or one of the therapists in outpatient, or you can go speak to one of the lovely ladies in the back. Oakview Suites, this is the administrative assistant at Oakview Suites, and then Majestic Oaks is Lucia, and that is our admissions coordinator. Who has questions? Nobody has questions? I did such a great job. There's one in the back, too. Hold on one second. They're going to bring a microphone.
Nicole, I want to thank you. The Healthcare Committee receives many, many questions related to the subject matter that Nicole just so beautifully presented to us and answered many, many questions. And I want to thank you very, very much. I think you made our life a lot easier for those of us on the Healthcare Committee. And I also want to say that the Healthcare Committee is very blessed to have Nicole and Amanda Logan as permanent members. So thank you.
Thank you.
If I have blood work from a primary care physician that's off campus, can I have my blood work transferred from here, have my blood work done here, sent out to my primary care physician?
Yes, and let me put a caveat on that. So there are lots of laboratory services available, right? You can have labs done at Advent Health, you can have them at Vista, you can have them at LabCorp, and you can certainly have them done here. We try to reach out to all of the physicians that we know that you deal with. If we see an order come through, we try to make sure that we send our lab company out to give them the portal to access your labs. They will automatically fax your labs to the provider that has requested them. But sometimes we hear that a lab didn't make it there and people are frustrated. That requires that they're able to get it off a fax machine, but some of these practices that have multiple practitioners, those fax machines get very busy. They run out of paper, they run out of ink, or they have to log into all of the lab portals that may be available to that practitioner. So if you do have labs, we recommend that you come see Celia a couple days after the labs if possible. She will print you out a copy to take to your primary so that you have that in hand in the event that it doesn't make it.
Martha came with a title in front of her, APRN. I don't know what that means.
It stands for Advanced Practice Registered Nurse.
You gave us an abundance of information, and that was wonderful, Nicole. But my question is there some place we can go to access that so we'll have time to study and review it and absorb it?
I would bet that it will be available on Cubigo as well as YouTube, and
it's already on Cubigo and under the information tab.
Okay. So it's already, the PowerPoint itself is already on Cubigo under the information tab. No other questions? I'm going to go talk about you in life care now. All right, well, thank you very much. I appreciate you coming out. I'll stick around for other questions if you have them. If you have anything that comes up in your healthcare needs, please don't hesitate to contact me. That is what I am here to do, is help you navigate through all of the various healthcare services. I am happy to sit down with anybody and discuss things. If you have concerns about healthcare that you've received, please call me. I want to do whatever it takes. I have moved several times. I am now in Oak Park with administration. So I am in the old clinic, so the second floor on the right-hand side of Oak Park. I'm actually in Martha's old office, so I'm in the back corner, beautiful office with 2 beautiful windows in the back corner. So, but I can be reached at extension 1022, and anybody is welcome to come see me. Well, thank you again. Appreciate you coming out. And again, the therapists are back there, and I'm here if you have any questions.